Hey guys, it's Arlyn of Awaken Spanda, and I'm coming on real quick before we do roll the video with Dr. Alan Comen. Today we're talking about iodine and we're talking about the thyroid gland. And where we're clearly talking about the thyroid gland, I keep saying thymus. There's a few times where I refer to the thyroid gland as the thymus. I think it was like 2 or 3 times. Um, I just wanted to make a quick disclaimer, a quick video just to note that so that you're not confused at all by what I'm talking about. Um, now, why I did this, why this happened, I have no idea. It's crazy. But what I like to do when things like this happen is look at it and I'm like, well, what is, what is spirit, what is my soul like telling me to look at with the thymus? And I'm like, The thymus is an amazing gland in itself, and it sits right between our heart and our throat, and it's the higher heart. And right now, I think it's kind of incredible that this came up, and I wanted to share with you a little technique that you can use in the morning when you wake up, and in the evening. You can use it whenever you're feeling a little low in energy. What it does is helps increase the vitality of the gland, and then it helps to increase your immunity and the flow of your meridians. So what you do is you take your fingers like this and you just tap right here on the sternum. You just tap. You just do it for as long as you want. You want to breathe while you're doing it. Now also another technique is to take a fist like this and you just want to beat on your chest just a little bit. And to add to that, you can add your vocals, like and you can do that as many times as you wish. And you will feel like right now, I actually feel a little whoosh of energy. Just helps stimulate the higher heart, the thymus gland, build your immunity, build your energetics. It just brings vitality. So I wanted to share that with you for whatever it's worth. Not let anything go unnoted. Sometimes that's how our souls speak to us. So that was to share, then that was to share. I wish you well and enjoy the video. I hope you gain some insight from Dr. Comen. He's amazing. All right, thank you guys. Wholeness. Okay, I think we're on. Hey guys, it's Arlyn of Awaken Spanda, and we are back today with another Pass the Mic. Pass the Mic is where we are dismantling the illusion that only the experts get to speak. In a culture saturated in academic ideas and belief systems, here we engage with a wide variety of people who align themselves to the sacred, to the ancestral way, and to consciousness. So basically, you won't be hearing the things you necessarily be hearing in the mainstream here. Our hope is to inspire those on their journey to sovereignty. So today we have somebody really special, a friend of mine that I've known for years, Dr. Alan Comen. Alan he has been in holistic since 1982. His practice includes clinical nutrition and functional medicine. He is also a doctor of chiropractic. And the cool thing is I worked with Alan for many years. I guess it was it 2004 or so, I think, that I began doing, I was a massage therapist with Alan. And he began to trigger me and initiate my whole like journey in nutrition and understanding body mechanics and minerals and all the things that I had never been taught in life. So I really just am especially enjoyed to have him here to share with us today, because he was really a part of my journey in this experience. So today we're actually talking about a subject that I find incredibly valid right now, and he got me started years back on taking iodine. And I kept a little journal like he had told me, and through that experience back then, my journal was all about like The changes I experienced were hormonal changes. So my moon cycle regulated. My dream state, my sleep state was enhanced. Like I slept deeper. I had broader dreams. Also, my mental cleared. So a lot of brain fog lifted when I began to take iodine. And I continued this practice for a few years until I went to California, and then I stopped for a while. And then when I came back to Charleston, I started taking it again. And then began to learn a lot more about really the some deeper effects, and we'll get into that. But right now, I want to bring Arlyn on, and so welcome. Thank you for being here with me today, Arlyn. I want to start by asking, just can you give us a little background into what got you into holistics to begin with, to study?
Well, originally, back in the 70s, I was going to Florida State University, and I was majoring in biology and chemistry, and I wanted to be an oceanographer. But when I graduated, I couldn't get a job. So I had friends that were in the chiropractic practices, and I ended up going to chiropractic school. And fortunately, I was in with a lot of people there who initiated my interest in nutrition. And I was very fortunate to be exposed to Weston A. Price's information on nutrition. And he was a dentist who went around the world in the 30s and 40s studying remote societies, and expected to find, teeth rotting out of their heads and all kinds of dental issues and malformed dental arches. And he found just the opposite. And what he found is that all these people that lived in remote societies who ate no refined food didn't have any of the four major degenerative diseases. So I don't even discuss nutrition with another healthcare professional unless they've read Weston Price's book, Nutrition and Physical Degeneration. But that's where my basis started.
Awesome. Yeah. Very cool. So let's get into iodine. Like, let's start with, can you just kind of give us an understanding of, what iodine is and where,
Well, it's a mineral, but it's considered what they call a halogen, which is, there's 4 different halogens on the periodic table of chemistry. And that is iodine, chlorine, bromide, and fluoride. And the other 3 are considered fairly toxic. And because those are so prevalent in our environment today, that those heavy halogens push out most of the iodine out of our system. And that being said, back in the early 60s, around 1962, most of the conventional physicians became iodine phobic for whatever reason and started reducing the amount of iodine in salt and in bread. So besides the fact that we're taking in less in our dietary consumption, we added the fluoride in our toothpaste and our drinking water, which is a whole nother issue we can talk about a little later, and chlorine and bromide, which are all toxic, and they push all the iodine out of your system. So we became severely iodine deficient. But that being said, mainstream also pushes, there's so many myths about iodine, and the 2 main ones that are pushed by conventional doctors is that we get enough iodine from our salt, and that taking iodine supplementation causes all kinds of other thyroid diseases. There are 2 big myths that are not even close to being true. The amount of iodine you get in salt, first of all, you can only use about 10% of it, and we're talking about maybe 30 or 45 micrograms of iodine, whereas my recommendation for most patients would be 12.5 milligrams to 50 milligrams, depending on how deficient they are. But iodine's been used for therapeutic events since over 100 years, mostly in the Midwest for goiters. But even medical doctors back then gave up to 300 milligrams a day if you had severe chest congestion, because it's a great mucus blocker, or it breaks up mucus very successfully.
Why do you think why do you think that they don't share this kind of information with us? Like what you know, like I like do you, I was, as I was listening to you, I was thinking, you know, like, because I know it has lots to do with the thymus. Like, I mean, if people were healthy, I guess they wouldn't really have a lot of business, right? Like, is
I
that
mean, if you talk to, I would say, 99% of endocrinologists, they'd tell you that you get enough iodine in your, in salt and in your food, and it's toxic, and they have no idea what they're talking about, They don't even know how to pick up subclinical deficiencies in iodine. And you can't successfully treat your thyroid without iodine therapy. Okay? And it's not only your thyroid, it's only 1% of the iodine resides in your thyroid gland. Your skin holds about 10%, breast tissue about 5%, and every cell in your body needs it. And you can't even produce any hormones without iodine present.
Tell us a little bit about the hormones, like how it relates. I know, because we were talking about that the other day, actually.
Well, again, it's vitally important. If you don't have enough iodine, you can't produce any hormone at all. I mean, never mind the sex hormones, both male and female, but you can't produce thyroid hormone, pituitary, adrenal hormones without iodine present. But what the really neat thing about iodine is that it gets rid of exogenous estrogens in the body, which are the estrogens that you have in your makeup and all your cosmetics and in the sunscreens and in the environment from the outgassing of toxic plastics and things like that. So it gets rid of all those bad estrogens. So only the good ones, the natural ones, reside in your body.
You're saying like stuff you put on your skin that's like bad estrogen? Is that what you were just saying?
Well, parabens are synthetic, or they're endocrine interrupters. They bind where estrogen should bind, so they're like fake estrogens. Even plant-based estrogens like soy are very dangerous to you.
Mm-hmm. I agree. So when you're like, when you get people on iodine, like what are some reasons, like why, like in your case, like
Well, I probably see hypothyroid cases every week, and they've been on Synthroid, which is a synthetic thyroid hormone, and it's only a T4 medication. And your thyroid produces T4, which is converted to T3, which is the active form. And by the way, that T stands for iodine, actually. So there's 4 units of iodine on T4, 3 units of iodine on T3. So without iodine, you can't produce enough of that hormone, okay? So they would come and they'd be on Synthroid. I try to get them off Synthroid and put them on a product called Armor Thyroid, which is from a porcine or...
Synthroid, sorry. Synthroid is that a medication?
Yeah, it's a synthetic T4 thyroid hormone.
Okay. Yeah.
So there's a few natural ones. Armor is the most popular. And I practiced in Connecticut for 18 years next to the Broda Barnes Foundation. Broda Barnes was a medical guy who was the guru of thyroid therapy. And I saw them put people on Armor Thyroid for 18 years. And I couldn't understand why people were not losing weight. They still had cold hands, cold feet, losing their hair and all this other stuff, until I accidentally came on to Dr. Brownstein's work, who's an MD and a researcher, and found out that just as soon as I added iodine to the thyroid protocols, everybody started responding. And myself personally have bad thyroid, and I was on Armor for a year, and my thyroid got worse because anytime you take any kind of medication, it takes over the gland or the organ's function. That gland or organ's going to get lazy. But for the last 20 years, I've been taking iodine, and my hands and feet aren't cold anymore, and I can actually sweat when I exercise, and everything is good. But the other main reason is because of breast cancer issues. And if you are diagnosed with any breast cancer that is hormone sensitive, not a triple negative, that's the only one that iodine really does not affect, but you'll see those tumors shrink up in between 30 and 90 days. And even if you've had cystic breast issues, you go on that and you get all new breast tissue so fast that the women are so happy that there's no more painful breast tissue, especially around their menstrual cycle. And, they don't have that predilection to have those cystic breast tissues turn into an estrogen-like cancer.
Right. So, I mean, I guess as a preventative, even as a woman, it would be a good thing to be taking iodine right now.
Right, and it's very simple to do a skin, test for iodine. You don't have to do the 24-hour urine collection where you would take,
Sorry.
yeah, the patch test, right? You're
Patch test is.
Well, what you would do, like, I don't know how old all your viewers are, but I'm a little older. So when I was growing up and I got a cut, my mom would put iodine on your cut, and you couldn't get that stuff off your skin for a week. It would be staining it, because back then, in the 60s, we weren't so severely iodine deficient, and we weren't drinking a lot of fluoridated water. But so right now, what you would do is you'd put about a 1-inch square patch of iodine on your skin. And I usually recommend Lugol's, which is 12.5% iodine. And the old days, we used to use 2 to 3% iodine. And the point is, this is a lot more concentrated. And what you would do is put the patch on, look at it, and it should still be the same or close to the same 24 hours later. What we find is that in like 3 to 6 hours, the patch is gone, which means your body's just absorbing it severely deficient.
Mm-hmm. And as the body, or like the receptors are receiving the iodine, it's actually flushing out like things like fluoride, bromine, metals, right?
Well, what we try to do is for the first 90 days, we work up to 50 milligrams a day, which is enough to force out those other heavy halogens.
Right.
And at the same time, it's very important to stop putting those things back in. So I always tell people, avoid fluoride toothpaste and stop drinking fluoridated water, which, by the way, is illegal in most other countries. And a lot of states don't allow you to do it. Most pediatricians or obstetricians that know what they're talking about don't let pregnant women drink fluoridated water. So remember, the fluoride that they're putting in our water system and in our toothpaste is not fluoride that's not found in nature, which is calcium fluoride. They're putting in sodium fluoride and silica fluoride. Very, very dangerous. It causes a lot of thyroid issues. I've seen thyroid cancers caused by it, bone cancers caused by it. So anyway, the other thing with when you're doing iodine therapy for thyroid disease, you should be using a lot of natural salts like Celtic sea salt, Himalayan salt, because that helps you detox from the other heavy halogens. You could get a thing called the bromide flu. Makes you feel pretty lousy when you're dumping all those heavy halogens out of your system. Yeah.
So that's one thing I noticed when I was doing detox with not fluoride, with the iodine. I would feel a little crappy at first, a little more brain fog, but then once it cleared, it was like.
Right. And the other thing patients have to be careful of is that there's a thing called an intracellular pump. And what that does, it takes the iodine from your bloodstream and puts it inside the cell. And a lot of people, because of the American diet, have a defective intracellular pump, which can be corrected very simply with about 3 grams of vitamin C over a 30-day period. So you don't get that bromide flu also. Or your iodine levels don't build up in your blood and irritate your thyroid gland. Even some holistic practitioners that I deal with think that they're a little iodine phobic because of that. But all they had to do is put the patient on a few grams of vitamin C for a month, and that would take care of those the high blood levels of iodine side effects.
So you're saying take the C along with the.
Yeah. And then don't start out at, I used to start out at 50 milligrams right off the bat, but I find it's better to start at 12.5 milligrams for a couple of days and go to, to 25, then 37.5, then get up to 50.
Right. So just
build up. Yeah. So you're detoxing a little slower.
Right. That's what I did initially when you got me on it years back. You had me build up, and then I kind of just stayed at a regular.
The RDA for people who know about iodine therapy is 12.5 milligrams of Lugol's, which is 7.5% potassium iodide and 5% iodine. Right. So you can get that at a compounding pharmacy. Will provide you with the Lugol's iodine, or you can get the lower dose even at Amazon for like 5%.
Okay.
Mm-hmm.
You also sell it too, right? You sell.
Yes. Mm-hmm. Yes.
That's what I. So let's talk about how does it affect the brain? Because we were talking about.
Well, it's very interesting because the reason why they keep fluoride out of pregnant women's diets because it really affects your brain and lowers your IQ. While all the studies show that if the pregnant mother is on iodine therapy during her pregnancy, the baby has a 10 to 15 point higher IQ.
Wow.
Okay. And I always joke around with the patient saying the only side effect about iodine therapy is that you tend to have good dreams.
Yep. I experienced that myself, so I know that for a fact. Does it have something to do with the melanin? Does it help produce melanin maybe in some way, like with the?
Well, that's just a pigment, but again, you know, the biggest majority of iodine resides in your largest excretory organ, which is your skin. So, you know, that being said, I've never, you know, really made a connection between melanin and iodine, but it definitely is protective against, you know, those nasty little skin tumors, you know, skin cancers.
Sorry, I was thinking melatonin, not melanin. I'm sorry. I went.
It does help the production of melatonin. Yes, any hormone. Yeah.
Right, not melanin. But yeah, that does make sense. But yeah, effects on the brain, because I know that for me the big thing was noticing that the brain fog cleared out a lot of that, like, and I guess that's more the toxicity that's accumulated. Do you think?
What I find is maybe about 10 to 20% of the patients get a little brain fog when they go on it immediately if they really start out in bad health to start with. You know, it's not only, you know, if I was to recommend one supplement to start with, if you're going to change your diet, I would probably recommend iodine, then magnesium, vitamin D, and definitely omega-3s. But iodine is so important because it has such a dramatic effect immediately when you start taking it.
Yeah. Mm-hmm. And with the water, like going back to that water thing, I always tell people, and that's one of my biggest things right now, especially, is like for you guys to really like be conscientious of your water intake and where you're getting your water from. I mean, our bodies are 70% water, so what we're taking in is so important, and we really don't want that fluoride.
Yeah, fluoride is just, it's so nasty. I can't even tell you. And again, there's a couple states that are prohibiting it from now. And it's just a political issue. The attorney that was the attorney for Alcoa aluminum, which fluoride is a byproduct of aluminum production, was also the attorney for the American Dental Association. So they started fluoridating the water. And, you know, I mean, now you look at all these kids' teeth and all these bright white spots on them, and that's fluorosis. It's very dangerous to have fluorosis. And even in the toothpaste, do not let your children use fluoridated toothpaste. You know, when you see the Crest ad, you have that big loop of toothpaste on the toothbrush. When you look on the tube of toothpaste, it's supposed to be the size of a pea. That's a safe amount of fluoride. They're taking like anywhere, you know, 10 times the amount of fluoride in, and they're swallowing it, you know, today. So does fluoride prevent cavities? That's still a question, but it definitely makes your teeth brittle. So you'll have no teeth at the end. So.
No, thank you. Yeah, I've been an anti-fluoride person for a very long time, especially with my my dental maintenance.
Mm-hmm.
Is there anything you can recommend that, like, as far as that goes, as far as like dental, like what's something that's not fluoride that would be?
Well, there's so many choices out there. At the health food store that you can buy non-fluoridated toothpaste. But anything from a light peroxide and baking soda mix. As long as you don't use so much baking soda that it clears the enamel off your teeth or anything. But That being said, I'm a no grain kind of guy, which is really what plaques your teeth. And, so, if you decrease the grains, you'll decrease the amount of residue that builds up on your teeth.
And if you probably stay away from processed foods and sugars, I'm sure that that would.
Well, no flour, no sugar. That's an industrialized, thing. And that's why we have more cancer, heart disease, diabetes, and arthritis in this country because of the amount of processed food that we eat. In the name of economics, because the longer the shelf life, the more, the more they can make. So,
Right.
I have a little anecdotal thing that I only eat food that bugs would eat in 3 days. So if the food lasts on the counter more than 3 days, you probably shouldn't eat it.
I totally agree. Yeah. Let's see. So could you speak on any correlation actually to like the pineal or pituitary gland and like how that, because I know that's correlated with the thymus as well. So
With the thyroid, but your pituitary hormones, thyroid stimulating hormone comes from there, but iodine doesn't directly relate to that. But the thyroid stimulating hormone, when it's present or it's elevated, it means there's not enough T4 or the primary thyroid hormone. And the reason that could be is because there's not enough iodine in the system to produce enough T4. And,
so then it affects all those glands.
That's right. Yeah. So, I mean, pituitary, extremely important, hypothalamus, completely, very important. But, again, we're talking about one isolated nutrient here that's very important, and it would make a huge change in the quality of your life. But that being said, there's much more to do than just iodine.
Yeah. Yeah. Speak into that a little bit. What are the, just in general, I mean, of course we're talking about iodine, but what do you want to add with that in general?
Well, when we're talking about thyroid treatment, we're talking about the conversion of T4 to T3. And you also need huge amounts of magnesium, which everybody in the United States is magnesium deficient also. You need selenium, you need zinc, and you need omega-3s. Those are like 4 major other nutrients that you need to have a healthy thyroid.
So let's see, can you speak into, okay, so today we obviously know what's going on in the world today in 2020. And there's a lot going on the world stage as far as health related issues and whatnot. If you could give any kind of like if you could tell somebody what's the best thing you could do to be boosting your immunity right now, what are some things you would tell people to do today?
You really need to get outside. You need to exercise. Turn the news off. But that being said, I mean, again, iodine, just think, I mean, all your blood goes through your thyroid gland like every 15 minutes. And you know how antiseptic, iodine is, because iodine kills viruses, bacteria, fungi, molds. So if you're saturated with iodine, your thyroid acts like a filter to clean out your blood, to clean out your, the blood every 15 minutes. Vitamin D is probably number 2 on my hit parade, and people understand, they think they're getting enough from the sun, but you need a 50% body exposure for 15 minutes. And then you can't wash those areas with soap for 48 hours because the vitamin D develops on the surface of the skin. It takes about 48 hours to absorb those, the cholecalciferol on the skin. So you can go shower, but just don't use soap on those areas. You can rinse off, but soap will wash that fat soluble nutrient off your body. But again, vitamin D produces, they don't even know, 2,000, 3,000 antimicrobial antibodies. So it works better than antibiotics or antiviral agents.
So cool. Yeah. I've always known of D to be like, or vitamin D, D3, I think it is, or
Right.
It,
D3 is the active form. D2 is actually toxic to take orally. So you need D3.
yeah.
And that being said, if you're taking more than 5,000 IUs of D3 a day, you need to be taking something called vitamin K2. And that's in the form of MK7. What that does is it takes all the calcium that the vitamin D is pulling in from your gut and into your bloodstream, and then the blood needs to know where to put that all that calcium. So the vitamin K2 puts it in your bones and in your teeth. It'll also take calcium plaque off your arteries or help resolve kidney stones and gallstones. And that was primarily from raw butter that people used to eat, but people don't eat raw dairy anymore. And you can also get it in goose liver, but people aren't eating a lot of goose liver. So you probably need to take a supplement of vitamin K2 if you're taking high doses of, of vitamin D3.
Yeah, I've always known of that. I guess I worked in a vitamin department at one point, and I remember it was always kind of the cancer fighter is what I kind of knew as the D3.
Mm-hmm.
So I guess that would kind of correlate.
Well, I've read probably 400 studies on D3, and all of them say no matter what disease process you have, if you get your blood levels to the optimal level, not the RDA that, or not the levels that mainstream is telling you to get, which is anywhere between 20 to 100 nanograms per milliliter. If you get them to 60 to 80 nanograms per milliliter, the outcome of every disease is greatly improved just by getting your vitamin D levels up that high.
That's awesome. Yeah. And speaking into the other, the iodine, I've been lately taking chlorophyll. Like I was just felt guided to do that, and it's been like amazing. But that's I think like the iodine.
Well, if the funny thing is that if people start to get a metallic taste in their mouth or a sinus headache, which means you're taking too much iodine, the way to resolve that is taking chlorophyll or broken wall chlorella. But remember, chlorophyll is the same thing as blood, except blood has an iron, iron molecule in the middle um, uh, of the 6-ring circle, whereas chlorophyll has a chloride ion in it. Otherwise, it's the exact same thing as blood. So when people are anemic, I give them ferritin or a natural form of iron and chlorophyll, and any kind of anemia resolves itself very quickly, especially if their hemoglobin is very low.
Right. Interesting. It's copper. I mean, like is the element copper that you're?
It's a chloride ion in chlorophyll. That's but
Okay.
it's iron in hemoglobin, just chloride ion in chlorophyll.
Interesting.
And the thing is, you really need to be taking a fat soluble chlorophyll. Don't take any water soluble. It's hard to find a good quality chlorophyll these days.
Chlorophyll?
Yeah.
Well, I don't know if it's quality or not, but it's been helpful.
Yeah, it's good.
I should look into that. I'm always willing.
But I've been using the standard process products for 38 years, and they have one of the best fat soluble chlorophyll products there is. If you open up one of the capsules, it's a mess, but it's good stuff.
Yeah. Cool. Well, is there anything else you'd like to say? Final words? Anything that you want to share?
Well, we don't have enough time, but no, I always believe that you can always heal yourself through food. That being said, with our stressful environment, mental and physical, you probably do have to supplement yourself a little bit. But the biggest expense in my life has always been food, but it's prevented me from being sick for the last 40 years and prevented my children from ever having to go to the doctor or be on antibiotics through their whole life. So, it's worth it.
I love that. That's perfect. Yeah. I really appreciate you sharing with us today. And actually, Arlyn is, you can find Dr. Arlyn if you are in the Charleston area. He's located in Mount Pleasant in the Ion. It's called Ion Health. And actually, I'll put all his information in the box below, so you guys can get in touch with him if you'd like to talk to him more about nutrition, or maybe getting yourself on a little program, or just ask questions, right?
Sounds good to me.
All right. Thank you so much for today, and maybe we'll have you back soon and talk. You know, there's always I can always talk health and wellness. I think that's one of the most important things we could be doing is getting to know our bodies right now, and getting to know the true science of our body. As you know, we're not taught these things in school, unfortunately, or we weren't. So it's our duty to get the knowledge out there. I appreciate you doing what you do.
Thank you. Nice talking to you.
Yeah. All right. Thanks, guys. Wholeness. Talk to you soon. Stay there, Alan.
You got it.